Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. Hi, everyone. Welcome back to the Breast Cancer Podcast. Today, I'm super excited. I have Jody Gibbs, who's a physician assistant in Columbus, Ohio. She's phenomenal. She's incredible. Her patients absolutely love her. She is one of my absolute faves. I love her too. And I'm so excited that she made the time to be here today. And part of the reason she's here today is she's an expert on this topic that we are talking about today. And this is continuing our Finding Your New Normal series. I talked about how the strategies to deal with fear of recurrence last month. This month, we're talking about menopausal symptoms, specifically hot flashes. So I want to take each and every one of these topics that women face as they're diagnosed with breast cancer. And for me, quality of life is such an important, passionate topic. And today we're going to be talking about hot flashes. And so Jody Gibbs, she's an expert on this topic. So I'm so incredibly grateful that she's here. And I'm so grateful that you guys get to listen from her. And so I'm super excited to talk about this. So we know over 200,000 women in the United States get diagnosed with breast cancer every year. And we know that a lot of these women are still premenopausal when they're diagnosed with breast cancer.
Right.
And so, unfortunately, we put them in menopause, whether it's chemotherapy, whether it's surgical menopause by removing the ovaries, or putting them on anti-estrogen medication like tamoxifen or aromatase inhibitors, or medical menopause with an injection every month, right? And you see these women. And unfortunately, menopause, it takes about 10 years for women to go through menopause, right? 10 years of going through the different side effects and symptoms. But unfortunately, when you're diagnosed with breast cancer, you're automatically pushed into menopause. Am I right with that, Jody?
Yeah.
So one of the common things that women come in and say hot flashes.
Right.
All of a sudden they wake up now. They never had hot flashes before. Now they have hot flashes.
Right.
So what are some strategies and tips that you give to the patients when they come in to ask you about the hot flashes?
Okay. So, I would say, first of all, I think it's really important to recognize that I have patients that come in a lot of times because of a certain age feel like they shouldn't have those side effects. And so people who have gone through menopause a lot of times is noted to be 10 years to get through it, but there's years of perimenopause, there's years of postmenopause. So that window of time can be different for everyone, and it can be really long. And some people it's a little shorter. When we give you these medications, you're right. That's one of the biggest side effects are hot flashes. And what's concerning about that is it is a quality of life issue. So you and I both, I think, really value that quality of life piece to it.
Yes, absolutely. 100%.
So
yeah.
When we first started giving medications for patients, that kind of threw them into one of those side effects being hot flashes. We really worked really closely to say, hey, let's get through 5 years of this. Like, you can do it. Let's do this 5 years.
Yeah.
And then all of a sudden these studies came out and they extended that amount of time. And so, trying to get someone through 5 years of quality of life issues compared to 7 to 10 years, that even makes it even harder for people.
Yeah.
I think sometimes people feel like they just have to deal with that side effect. So, in some ways, people feel like a hot flash, is that debilitating or not? When they try to talk to other people about it, sometimes people understand that, and times people don't. The other piece to that is, what is a hot flash, right? So some people have a hot flash and it's what you would think it would be. It's sweating to death. It's your sheets are wet, your hair's wet. Some people have a hot flash and it's more of a tingling feeling, or some people have a hot flush, what they call it, not a flash. And
Mhm.
so they feel like it's just a really warm feeling. And so people aren't sure how to place value on that. Like, what do I talk to somebody about? When does it get to a
Mm.
point where it's an issue or not? And so it's really important to know any of those things are an issue. We want to hear about all of those things so that we can help you through what you're feeling.
Those are all like really important points. So, what is the first thing you tell patients or ask patients? Do you ask about their triggers?
Right, right, right. So that's a good point. So
Yeah.
sometimes the first thing you think about is, what do you have in your control right now to help with the hot flashes, right?
Yeah.
And you're exactly right. Like, are there triggers?
Yeah.
And there can be triggers.
Yeah, that's typically what I say is, what are your triggers? Or
Mhm.
do you have a record of when these hot flashes come on?
Yeah.
Is it when you ate something really spicy?
Right.
Is it something after you drank alcohol?
Right.
Or is it
Exactly.
something you have like too many layers of clothing?
Right.
Or are you in a stressful environment?
Exactly.
So those are some things I think it's important for us to always kind of know, always talk about what is causing them,
Right. Right.
be educated about how then we can decrease the amount of hot flashes that we get.
Right. Right.
So, what are some tips? And I want to give some tips and strategies for audience to follow for when they have hot flashes. And so, I have some tips that I want to talk about. I want
Yeah.
to see what tips that you have, and maybe we have the same tips for
Sure.
for our audience. But so, let's talk about one strategy at a time. What would
Okay.
be a number one tip that you would tell them?
Exercise.
Yeah,
So that's been
yeah,
one thing that's been studied and proven.
yeah,
So exercise that you can really feel it. So I always kind of recommend 4 times a week,
yeah,
give or take what you can do. But extra and the timing of exercise, I don't know that it matters. Like, it's not an hour of exercise that you
yeah,
have to do, but it's definitely something that gets your heart rate up, something that
yeah,
you kind of are a little short of breath doing,
yeah.
and that's been proven to decrease
The hot
hot
flashes.
flashes.
Yeah,
Yeah,
yeah.
yeah.
And how about like alcohol? Do you know of any evidence
Yeah,
or
no, I think
research?
that, well, and I think it's everyone's different with all of these, right?
Yes.
Someone's going to exercise and say, "Oh my gosh, I noticed a great decrease in my hot flashes," and someone's going to try that and not notice it as much.
Yeah.
I think the other thing to know about that is with alcohol. Like, some people are going to, have that reaction to alcohol, and some people aren't. Sometimes it's recognizing, what did you react to before. So if you've gone through menopause before and you notice those triggers, it might be the same with these medications. But yeah, no, I agree. I think it's exercise, alcohol. What are some other ones that you recommend?
Yeah. So I will say, like sleeping, menopausal symptoms also disrupt your sleep. So some tips that I usually talk to our patient population in general would be, sleep is a big thing, right? I mean,
Mhm.
now we
Yeah.
know it, lack of sleep can cause dementia,
Mhm.
Alzheimer's,
Right.
heart disease, and, increased mortality actually. So what are some things we can do? So there's number of things for sleep.
Mm.
So are you sleeping in an environment that's cooling enough for
Right.
you?
Right.
Is your bedroom cool? And you want it to be around 68 degrees Fahrenheit or
Mhm.
lower, I
Mhm.
believe. The sheets, are you wearing synthetic clothing? Are you
Right.
wearing cotton clothing? Are you
Right.
sleeping on cotton sheets? There are these pillows that are made that have coolant in it, so
Mhm.
it actually feels cool on your
Mhm.
neck and your
Yeah.
back. Do you have a fan next to you? Do you have a
Right.
fan overhead? Do you have an air conditioning in your room?
Right.
Even like sometimes I sleep with one foot outside the
Yes.
sheet.
Yes. Yeah.
That somehow it feels like
I do the same thing.
you feel kind of
Yes.
cool.
Yes.
So
Yes.
these are
Yes.
some like simple strategies to
Yes.
follow.
Yeah.
I actually had a patient the other day. She came in and she had this fan on her neck
Yes, I've seen
that,
that too,
yeah,
yeah,
that she got it from Amazon. I thought, oh
yeah,
my gosh, that is such a great thing to have,
right,
is a fan around your neck. So I would say those are some strategies for cooling your body, wearing layered clothing, more
mhm,
cotton clothing, and sleeping on cotton sheets and
mhm,
sheets that kind of, you can also find sheets that are kind of cool, like
right,
just keep you
right,
cool through the
yeah,
night.
yeah. No, and ice water before you go to bed.
Yes. And
Like, that's
that's,
just something that, I
yes.
I learned recently
Yeah.
that helps with
Yeah.
your body temperature
Yeah.
too, and
Yeah.
so that can also help bring things down a
Yeah.
little.
Yeah. Just to have like a
Um,
cool water bottle right next
yeah,
to you if you need to in the middle of the night to
yeah,
drink that.
yeah, yeah,
I'm also noticing that having a higher body weight, like BMI,
mhm,
can also increase hot flashes. So
okay,
studies have shown lower body weight, BMI, like under 27, 28, something like that,
right,
that does decrease the number of hot flashes one gets. So
right,
again,
right,
to your point of exercising, I think it's
right,
really great. to, exercise, we know it releases endorphins, great for cardiovascular disease, decrease the risk of cancer coming back by
Right.
30%. When I always talk about exercise because that's something that's in our control that we can
Right.
do
Right.
and we
Right.
can help others.
Right.
What is one other thing that you would say?
Um, as far as so we've talked about keeping a cool room. We've talked about triggers like food and drinks. So
Yeah.
if there's anything that triggers you there, I think another thing, and I do believe this has been studied also, is meditation.
Yes.
And so I'm hard to tell you about meditation
Yeah.
because I'm horrible at it, but I'm trying to get better. There are great apps
Yeah.
that you can get that I think are really helpful that
Yeah.
kind of guide you through. And again, that doesn't have to be an hour of your time. Really, we're talking about 5-10 minute snippets of your time. I think people do notice a decrease in hot flashes if you take time to meditate either 5 to 10 minutes in the morning and 5 to 10 minutes in the evening. And again, those guided like Headspace, Calm, there are several
Yes.
apps. And some of those apps, if you Google kind of like free 10-minute guided meditation, you don't have to pay anything for it. And
Yeah.
you can get that kind of guided. And I need that guidance right now.
Yeah.
I don't know how you are with meditation. I'm trying to get better. I think it's a really great tool. And I
Yeah.
think it's really
Yeah.
important.
The one thing I notice in our patient population when I see them is people don't take deep breaths.
Right.
And
Right.
that is such an important thing to calm your nervous system down,
Yeah.
to activate the parasympathetic nervous system where you
Right.
want to take deep breaths. And so sometimes I listen to their lungs and, I'm listening to their lungs, but really I'm hoping that they're
Yes.
calming down by taking some
That
deep
is so
breaths.
funny. I do the
Yeah.
same thing.
Yeah.
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 So the cognitive behavioral therapy, such as meditation, like even hypnosis is talked about,
Yeah.
where it is really helpful for dealing with hot flashes,
Yeah.
amongst a number of other things that meditation helps.
Right.
Again,
Right.
fear of recurrence, anxiety, and all those things. But it is also shown to help with hot flashes.
Right. Right. Right.
And so we talked about exercise. Now, smoking.
Okay. Yeah.
Smoking is a big thing, I think. And number of studies to show smoking can increase hot flashes.
Mhm.
History of smoking, not even current smoking,
Okay.
or if you're secondhand smoke, you're
Mhm.
exposed to smoking as secondhand, that can also increase hot flashes.
Right.
So that's something that again, it's in our control
Right.
to maybe if you're if you're in exposed to the secondhand smoke, maybe to take yourself out of those situations. If you're smoking, I know this is the toughest thing for men and women to stop doing right when they're told that they have cancer to stop smoking
Right.
because you're this stressful situation, you've just been told you have cancer.
Right.
Now we are telling them, no, you need to stop smoking
Right.
because
Right.
it impedes healing, like so many adverse effects with smoking.
Yeah.
But I know studies have shown, looking at some data just before this podcast, is smoking can increase hot flashes.
Okay.
So dietary modifications, do you talk about any specific diet that you tell your patients that could increase hot flashes?
Again, for me, what I talk about is more just what triggers them. So
Yes.
is it spicy food?
Yes.
Is it, sometimes the amount of food? Is it, there are different triggers that if
Yeah.
they start to recognize kind of increases that symptom for them, then
Yeah.
it's something for them to recognize. Is there anything specific that
Yeah.
you tell
So
them?
we actually had a dietitian, Allison Tierney, on
Yeah.
our
Yeah.
podcast. She's phenomenal.
Yeah.
So she really talks about eating natural soy products.
Oh,
So
sure.
that
Yes.
actually does
Yeah,
help
absolutely.
with dealing
Yeah.
with hot
Yeah.
flashes.
Yeah.
So that's something that you can do is incorporating some soy in your diet, you know, contrary to what people believed in the
I was
past.
going to say it's
Yeah.
good to kind of recognize. I
Yes.
think
Yeah.
soy can be kind of a trigger word
Yes.
for people,
Yes.
and I think it's
Yes.
good for us to
Yeah.
kind of give that permission
Yeah.
that it's not what we felt like it
Yeah.
was maybe.
And if you think about
Or
it, in those countries, in Japan and some other Asian countries where
right,
breast cancer incidence is not as high as the United States, they do eat a lot of soy.
right, right,
So it is helpful in decreasing not just hot flashes, but also decreasing the risk of incidence, the way that the soy works in our body. And I would highly recommend going back to that podcast to listen to Allison. She does a beautiful job in explaining it,
yeah,
but it also helps to decrease, hot
yeah,
flashes.
yeah.
I don't know if we touched on alcohol yet. Did we talk about
Yes,
alcohol?
yeah,
Yeah.
yeah, yeah.
So alcohol, increases body temperature, and the way that alcohol works is dilates blood vessels,
Mhm.
which can also cause increase in hot flashes. So we touched on that.
Sure.
Before going to the non-hormonal medications, I do want to talk to you about acupuncture. Have you
Mhm.
seen people who say that they've been?
I have seen a good result with acupuncture.
Yeah.
I am kind of specific in making sure that I'm aware of who I'm referring to.
Yeah.
Because, everyone has different training and people go about it in different ways.
Oh, is that right? Okay,
So,
that's good to
so
know.
if I talk with someone
Yeah.
who's gotten a good result with
Yeah.
the practitioner who's doing it, then
You
I'm
refer to
gonna,
them.
yeah,
Okay.
I'm gonna absolutely find out more
Okay.
about that.
That's
And
wonderful. Yeah.
yeah, but again, it's like with all of these, like you're gonna find things. Some people are gonna be more comfortable eating soy, some people aren't. Some people
Yeah.
are gonna have triggers with alcohol, some people aren't.
Yeah.
So, it's a matter of just kind of gathering this information. I
Yeah.
think acupuncture, if you're skeptical going into it, I don't know what kind of result
Yeah.
you're gonna get,
Yeah.
but I do feel like I definitely have had some patients who have
Yeah.
gotten really good results with it.
Okay. Wonderful. Wonderful. So one of the last topic I want to talk about is non-hormonal
Sure.
medications.
Yeah.
What are some things that you recommend
Yeah. Well,
men and
first off,
women?
vitamin E. I've always
Yes.
recommended vitamin E. So I personally had a total hysterectomy with my ovaries out at age 40.
Oh,
So
wow.
I'm the one that
So you
has,
experienced it.
yes,
So
yes. So
this is not just talking
this
the
is
talk, but you
no,
walk the walk.
no, I
Yeah.
understand where you're
Yes.
at. And
Yeah.
so, yeah, so I'm the one that has the window cracked and a fan above me and a fan at my feet and, the cooling sheets
Yeah.
and all of those things. And
Yeah.
so, I know that it can be a lot. And so, vitamin E, I tried vitamin E personally. I did feel like it decreased the
Yeah.
severity of it. I get mixed reviews. So, but I do recommend it because I do have more people that have had
Yeah.
results from it than not.
Yeah.
And so because of that, I feel like it's a good thing to recommend.
As opposed to magnesium, have you seen women talk
For me,
about?
like, that's kind of a newer thing that I've learned about as far as it
Yeah.
affecting hot flashes. I think it's good for relaxation and
Yeah.
sleep, and so
Yeah.
I can see why
Yeah.
it can be
Yeah.
beneficial. I personally, I do take magnesium glycinate is the
Yeah.
one that I take at
Okay.
night,
Okay.
and I do think it helps relax and helps sleep,
Yeah.
and so I do
Yeah.
think it's a
Yeah.
beneficial thing. Like I'm not really big in a lot of vitamins and a lot of different things because
Yes.
sometimes
Same.
I think it can be really
It
overwhelming
can be
for
too much.
people.
Yeah. I
Yeah,
take magnesium glycinate as
yeah,
well.
yeah.
It does help me to calm down a little bit because I'm always so excited and excitable. I think
Me
we both
too.
are
Me
like
too.
so I need things to calm me down. And so magnesium glycinate, I feel like it does help
Mhm.
me to
Yeah.
actually it makes me sleepy, I think too.
Yeah, it's
So
also, I mean, people who have constipation or like
yeah,
it can help a lot of different things. So
yeah,
I
yeah,
think I think it hits a
yeah,
lot of different places,
yeah.
and hot flashes may also be one of those things.
Yeah,
So
yeah. And, as always, I recommend you talk to your healthcare provider.
absolutely,
We are
yeah.
not here to give you medical advice. You want to talk to your healthcare provider to make sure that medications you're on do not interact with the medications that we are recommending for
Mhm,
you.
mhm.
So, antidepressants, those seem to work really well,
Yeah, yeah,
right?
they do. And sometimes people are nervous about them because I
Yeah.
think there are still
The
thoughts.
stigma. Yeah.
Exactly,
Yeah.
exactly. And I think it's unfortunate because I
Yeah.
do think for some people it's a real game changer and
Right.
it can really
Right.
make a difference.
Right.
So there are different ones that kind of contribute more to helping with the hot flashes. There are also ones that you can't take if you're on one of the medications like
Yeah.
tamoxifen. So
Yeah.
that is something you want to talk with someone who
Yeah.
is aware of what all of that is. And
Yeah.
so when they do the recommendation, they're not hurting something that you're already taking. But
Yeah.
I
Yeah.
do think people do get
Yeah.
really good results with it.
You have to be careful as to what type of antidepressants you're on. Tamoxifen, the mechanism of action, sometimes can interact with the antidepressants. So you do
Mhm.
want to talk to your healthcare provider. The typical ones that I recommend, and Effexor
Mhm,
is
right,
one.
Effexor is one. And some of these, it is good to have someone to guide you through it
Yes,
because it's not these medications aren't something you just want to start and stop at all
yes,
different, because
that is a
that
great
can
point.
affect
Yeah,
you a little differently.
yeah,
So you want someone who is can listen and hear you and
yeah,
knows
yeah,
that okay, let's start this, see how
yeah,
you do. And if you want to get off of it, what's
yeah,
the good way to kind of wean off of
yeah,
it? And you can wean off of it very successfully. It's
yeah.
just a matter of making sure you're guided in the right way for
Yeah,
that.
100%. That's the most important point is how you start and how you stop is very
Hmm.
important. You can't
Yeah, yeah.
take it abruptly, stop it abruptly.
Right,
So make sure
right.
you're talking to your healthcare provider. So some medications I will mention again, please talk to your healthcare provider, or Effexor is one, and Neurontin
Mhm.
or
Yeah, gabapentin,
gabapentin also
sure.
seems to help with hot
Yeah,
flashes.
yeah.
Clonidine is a
Mhm.
medication that's typically used for high blood pressure,
Right.
also seems to help. The one I recently heard is oxybutynin, which
Mhm.
is a bladder medication
Yeah, yeah.
that also seems to supposedly
Yeah,
help
I've seen that,
with the hot
prescribed.
flashes.
Yeah, I
Yeah.
haven't prescribed that myself, but I have seen that utilized and people get good results.
Yeah. And
Um,
one of the newer
I know I'm
medications.
excited
All
about
right,
this.
I can't wait to hear your take on this. Yes. So Vioza, and I really
Yes.
can't say the
Yeah.
generic name of it,
Yes.
but Vioza.
I'm so glad you can't either. I'm like, we'll
Yeah.
just go with Vioza,
Yes,
right?
yeah, exactly. So, it works for blocking the activity of neurokinin 3. It's a chemical in the brain that helps regulate body temperature.
Yeah, I think, and it goes back to, I think it's good to recognize
Yeah.
like we have estrogen receptors
Yeah.
in our brain. And so
Yes.
sometimes we just have these side effects and we don't understand what are these side effects coming from and why are we getting them? And I think it's good to know like our brain has estrogen receptors. And so other things we'll be talking about like mood and anxiety, like at a different time, like that is affected. And of course it is. And it's not anything that you're doing to cause it at all. And it's not caused by the cancer. It's caused because we're blocking it and
Yes.
manipulating that estrogen. And so Vioza has come out, which is pretty exciting because we try all these other things first, right? Like these are all great options and definitely can make a difference, but there are times where they don't. And hot flashes do affect quality of life. They affect sleep, they affect mood, and they affect other health issues. So, it's something that we do want to have under control. And so when we don't have the option of what we would consider hormone replacement therapy, so systemic estrogen therapy, then Vioza is where it's at.
Yeah.
So we really have gotten some good results with Vioza. Some people I think are a little intimidated by it and that we do have to check liver enzymes so you check liver enzymes every 3, 6 to 9 months for the first year, and then you no longer have to do that. But people get really good results with it. So for me, it's finding cost-wise, how is it for people? Sometimes it is something that we have to sign a form for, or we have to prove you've tried other things. And which is kind of frustrating because we have breast cancer patients who can't take estrogen and then we have to prove to them people why so that can be kind of a frustrating space, but it's not something that can't be handled. And so it is definitely something that is good to talk with a provider and see if you're a candidate for the Vioza.
Yeah. Thank you so much. That's great information. It's a newer medication. I've only used it a couple of times in patients. I've had patients say good things about it.
I have too. I've had patients. I always look to see, are we getting refills? Are we, wanting to continue? And I've had patients now that have wanted to get the refills. And so as a provider, I tend to see them back in 3 months. So I'm sure we're getting that 3-month liver enzyme and I'm getting the sick, so I'm a little closer follow-up for me within that year when you're taking it, just so we're sure we're doing what's recommended, not because I'm worried about you taking it.
So, that's wonderful. All right, Jody, this has been wonderful. I'm just going to recap really quickly what we talked about. So today we're just talking about hot flashes. I really am praying and hoping that Jody's going to come back again in the future because there are so many topics to talk about and she's full of knowledge and wealth of information. And she's done this for 15 years. She's been a physician assistant, taking care of breast cancer patients in Columbus, Ohio for 15 years. So I'm going to talk about where to find Jody Gibbs in just a minute, but I'm just going to recap about the things we talked about today. So we talked about hot flashes. This is part of our Finding Your New Normal series and just improving your quality of life. Just because you had breast cancer doesn't mean you cannot have good quality of life. Our hope is that we give you tips and strategies to have better quality of life. Number one, find what triggers you. What are some triggers that are causing the hot flashes? Number two, keep your core body temperature low. Some tips that we've given you on how, when you sleep, kind of clothing you want to wear. And then we talk about food. We talk about, maintaining a healthy body weight. We talk about exercising. We talk about dietary modifications. We talk about, avoiding alcohol. She talked about meditation, mindfulness. That's really important. Acupuncture. And then we talked about non-hormonal ways to take care of hot flashes. You've been incredible, Jody Gibbs.
Thanks for having me.
You've done this for 15 years in Columbus, Ohio is where you work. If people want to find you, where can they find you?
So we recently created a program or practice with a friend of mine who's a therapist. And with all the list of things that we're talking about, we found there was a gap in how to follow through in the recommendations, right? We have like 15 minutes, 30 minutes time slots. And we have great teams. We have survivorship, high risk. We have, our, breast surgeons and great recommendations, but there is a gap in what do people do with those recommendations in between those visits. And so I created a program with my friend who's the therapist under under Enliven Health and Wellness in Columbus, Ohio. We have an office space with a parking lot, which we think is really important because it's in Victorian Village. So there is parking there. But we provide the mental health piece as well as that physical wellness. We kind of married those together. And that way we can, when we see a client, if there's questions about some of those recommendations that we've just listed off, how do they do that? And how do they put that into a plan? And if there's anxiety that's gone along with that diagnosis, then we're here to kind of help with that and guide them through that. So we don't see just breast cancer patients.
Okay.
We see all patients that have cancer or not have cancer. And so really we consider ourselves a women's well-being practice to help you through kind of those transitions in life.
I love that.
So yeah, we really enjoyed being able to be
Yeah.
a resource in Columbus, Ohio. So
Where can we find you?
Yeah, so Enliven Health and Wellness is the name. We're under that practice, and you can reach us at 614-940-4868. Ask to speak with ask to speak with Annie, and just ask to get connected with the breast health or with the women's well-being program. So
awesome. Thank you so much.
Thanks
And
for
I'll have
having me.
all that information on the website.
Okay, great.
As well as on the podcast. So
Great,
people know where to
great.
find you. Thank you
Great.
so much for taking
Thanks
the
for
time to
having
be
me.
here.
Really
I
loved
really appreciate it.
Thank
And
you.
we hope you come back.
Absolutely. I would
All
love
right.
to. Thank you.
Thank you, everyone. Thank you so much for joining us. I hope you found this podcast to be useful. If you do, please share it with other people and give it a 5-star rating. It's good seeing you guys and good talking with you. Bye-bye. Take
Bye.
care. See you next month. Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer, this podcast is not intended for complete medical advice, so please talk to your medical professionals.